Now we're going to talk about some specific parameters for muscle strengthening and endurance using electrical stim. We're going to talk about the electrode type and placement, which we've already talked about a little bit, and motor points, and how frequency, duration, on-off time, and ramp time affect the overall motor response with electrical stim. And which parameter would you change if a stimulated muscle were twitching and you wanted to elicit tetany? Okay. So the indications again, and we talked about them, and the one that I left off here is the the functional electrical stim, which will be in the last part of the lecture. But increase muscle strength, enhance performance in healthy muscle, improve muscle endurance, facilitate range of motion, and modify spasticity. So to improve muscle force, the purpose of doing the electrical stim is to facilitate motor recruitment in a muscle that's inhibited by pain or other non-neurological factors. So when we're talking about just improving muscle strength, a lot of times we're talking about an orthopedic condition, not a neurological condition. We might be trying to augment a motor unit recruitment for muscle force. So maybe your quadriceps are inhibited after surgery, either because of pain or edema or some other reason, some other non-neurological reason. And we're trying to augment that muscle force and retrain the inhibited muscles to fire. There are ways to do that without electrical stim that you'll learn in your neuro rehab class, but um, just to know, electrical stim is one of the interventions that you could use. Most studies in this for this particular application are done with the quadriceps following knee surgeries. And so that is a really common time to use them. And in fact, as a patient, my first encounter with electrical stim was after my knee surgery, and they used electrical stim to augment motor recruitment and muscle force in my quadriceps. So that's a common application. So the amplitude and the pulse duration that we want to use, so here's our strength duration curve, which you should be really familiar with by now. We want the amplitude enough for a full muscle contraction compared to the uninjured limb. So if you're just getting this weak little twitching, it's not enough. You got to turn it up. The pulse duration is to recruit alpha motor neurons, which are going to stimulate our muscles, is 150 to 350 microseconds. So less than 200 microseconds is usually adequate to recruit alpha motor neurons and reduce recruitment of pain axons. Greater than 400 microseconds for large muscle groups. So this is going to be so individual for a person. So I am always the electrical stim application that I use the most in the clinic is functional electrical stim on the functional electrical stim bike. And so I'm always playing with the pulse duration and amplitude to get the reaction that we want with the maximum comfort for the patient. And everybody's different, just so you know. So the frequency, it's going to require a certain amount of frequency to get a full tetanic contraction and not just twitching. So small muscles might get to that full tetany at 20 to 30 pulses per second. Larger muscles probably need 35 to 50 pulses per second. 50 to 80 pulses per second might increase muscle strengthening, but it also increases fatigue because remember, frequency is increasing the number of action potentials, and so the muscle can fatigue out pretty quickly. So just like everything, we want the minimal effective dosage, just like everything. So, but if you don't have enough, like say that you're stemming somebody's quads and you've got it at 30 pulses per second and you're getting twitching for sure, but you're not getting the muscle contraction that you want, you may have to turn up the frequency. You will have to turn up the frequency on quads if you're at 30 pulses per second. And that goes for cycles per second as well. And beats per second for Russian stim. So the number of impulses per second that you're getting, whatever terminology you're going to use, is the frequency. So the duty cycle, that's on-off time, remember, it permits work rest patterns. So usually you start at 1 to 3 or 1 to 5 ratio, and that can minimize fatigue. So what that means is if you're doing a 10-second muscle contraction, that's 10 seconds on to 30 seconds off. And if you're doing 1 to 5, it's 10 seconds on to 50 seconds off. It's one muscle contraction per minute. Think of it that way. So there's a lot of what I usually do during that off time when I'm talking to the patient is I talk with them and I say, okay, how did that feel? How was the amplitude? What did the muscle feel like? That sort of thing. And then as I see we're getting close to that end of that rest time, I say, okay, we're getting close to it. It's going to start ramping up again. Let me know when you feel it. And you're looking at the machine, you say, there it goes. And they go, yeah, I can feel it. So there's a lot of coaching that goes on during an electrical stim session for muscle strengthening. So once the muscle endurance improves, you might reduce the ratio to 1 to 2, so 10 seconds on, 20 seconds off, or 1 to 1. And there are some particular applications, which we'll talk about in the next section, that you start with a 1 to 1 ratio. And when you're doing a 1 to 1 ratio, starting with that, you're trying to fatigue the muscle. So the reason we start with those longer rest times is we're trying to minimize fatigue. So 10 seconds on, 50 seconds off is a place to start with a weakened muscle. And that might sound like a really long rest time, but remember those type 2 fibers are going to fatigue a lot more easily. So sometimes functional electrical stim has like a remote switch that can override the duty cycle. So the patient says like, okay, I'm fully recovered. I'm going to start the next muscle contraction. So it basically that gives the patient control. The remote switch gives the patient control of the muscle contractions. So ramp times, unlike rise time, which is not perceivable, ramp time is the real time in seconds that it takes to reach the peak amplitude. And it protects joints from jamming at the end range and provides a more comfortable application of the stimulus. It allows the patient to get used to the stimulus. It's part of the on-time cycle. So if you have a 1 second ramp up and 1 second ramp down in a 10-second on time, then you have 1 second ramp up, 8 seconds at full, and 1 second ramp down. So it's part of that full cycle. And it varies with the equipment though. So read your equipment manual, make sure you know what yours does. And sometimes if someone is having trouble tolerating the stimulus, you might need a longer ramp time. Just bear that in mind. So we want to minimize muscle fatigue. So increased rate of frequency is going to enhance motor unit recruitment. But neuromuscular fatigue is the limiting factor on how high you can turn up the frequency. So the large muscles, 50 to 75 pulses per second or beats per second, or cycles per second, that is going to be probably what you'll need to do. The duty cycle has to allow for recovery. So that 10 minutes, 10 seconds on, 50 seconds off, or 10 to 20 contractions per treatment session rather than a time limit per session. So if we're doing 10 seconds on and 50 seconds off and we want 10 muscle contractions, it's going to take 10 minutes. If we want 20 muscle contractions, it's going to take 20 minutes. Hopefully that makes sense. If we have 10 to 30, it's going to take a shorter amount of time. So that's the duty cycle is really important for allowing for recovery, minimizing fatigue, and really kind of getting the most out of your session. So with waveform, so you can use Russian current, which is a medium frequency sine burst modulated current. Or you can use a biphasic pulse. And hopefully you got to try them both in lab. And if you didn't get to try them both in this most recent lab, try them in the last lab and make sure that you understand the settings and you understand how each one feels. And neither one is quantifiably better than the other. A lot of times it's just comfort. Your comfort, like what you feel comfortable with in terms of settings and setup, and the patient's comfort, what they feel comfortable with. So I know people that only ever use biphasic, and I know people that only ever use Russian, and that's the therapist's choice. So your mileage may vary. The bottom line is that neuromuscular electrical stim can be used to enhance muscle force production, particularly when performance is inhibited by pain or other factors, and the client can't maximally recruit motor units voluntarily. So this is like in an orthopedic setting, like post-surgically, um, the maybe your knee extension is limited by pain or it's limited by edema, or a lot of times right after knee surgery the quadriceps are just inhibited. They're just like, leave me alone for a few days, let me recover. And but neuromuscular electrical stim can be really useful during this period. Um, Waveforms with high peak and low average current with durations of less than 200 microseconds are most desirable to recruit large or deep-lying motor axons with minimal discomfort, but they may not provide an adequate pulse charge. So um, the most comfortable isn't always the best choice. So I always tell patients that if it's going to feel bitey or this isn't going to be comfortable, but we want the muscle to contract, and it's only going to be contracting for 10 seconds, and then you get to relax. So I there's a lot of coaching that goes on with that. So even though the less than 200 microseconds are more comfortable, you might need to have a pulse duration of 400 microseconds or more. And having plotted your own strength duration curve, you might know more about your particular um, settings that work better for you. And you're going to have to work on that with your patients as well.